is Nurfala Izzati binti Muhammad Azhar, and my student ID is 2024783899.
Hi, my name is Shaza Putri Balkis binti Saluga and my ID student is 2024753109.
Alright, hi. My name is Siti Karisa binti Abraham and my ID student is 2024776667.
Hi, my name is Nobatisha binti Muhammad Firdaus. My student ID is 2024946927.
So my name is Nifsawan Natasha binti Ramazan Khairudi and my ID student is 2024784027.
In December 2019, a cluster of Factable respiratory disease case of an unknown cause was detected in Wuhan, Hubei province, which was subsequently attributed to the severe acute respiratory syndrome coronavirus 2 SARS-CoV-2, which is COVID-19. The disease spread quietly within China and across the globe, where Thailand, a country bordering Malaysia, was the first country outside of China to record its first confirmed case merely 2 weeks after the outbreak was declared. The disease reaches Malaysia on 20 January 2022, with 3 positive cases reported. The Malaysian government, through the Ministry of Health, has taken intense precaution and steps to beat the coronavirus disease, yet has had many problems, while the urge to curb the spread this pandemic as each of everyone's life and society is being affected. Therefore, the government, with especially Ministry of Health, control and handle the pandemic by using POLC method to overcome the disease.
Next, I will explain about planning by Ministry of Health. Planning is the process of thinking about and organizing the activities required to achieve a desired goal. It involves setting goals and identifying the tasks that need to be done to achieve them, as well as the resources that are necessary and the time frame in which they should be accomplished. The importance of planning is first to set clear goals and think ahead. Second is to prioritize tasks and use the resources efficiently. Third is to reduce uncertainty, anticipate future challenges and opportunities. Fourth is to improve decision making, problem solving and coordination. And the last one is to ensure objectives are achieved on time and also within budget. COVID-19 was appeared in late December 2019 in Wuhan, China. The outbreak continued to spread in early 2020 and was declared a pandemic by the World Health Organization on 11 March 2020. The Ministry of Health moved swiftly into a planning mode. Due to its fast spread, the virus posed a serious threat to public health and healthcare system. The MOH team realized that in order to stop the virus spread, they need to move quickly. Ministry of Health implemented Movement Control Order, which is MCO, and lockdown to slow down epidemic spread. And then the Ministry of Health continuing to focus on rolling out its national vaccination program to improve public health, while also collaborating with other sectors to increase vaccine availability and raise public immunity. Next, standard operating procedures (SOP) have been established by the Ministry of Health and are required for all Malaysian citizens. According to this SOP, Malaysians must avoid crowded areas, avoid taking needless trips, stay at home whenever possible, and keep social distance by keeping a 1 meter gap between oneself and other people. The last one is the Ministry of Health implies the necessity of wearing a mask when going outside to help prevent to spread of COVID-19. It is strongly advised to people wear masks at all times when leaving house, particularly at congested public locations like malls, markets, and young centers. It also recommends to have hand sanitizer for hygiene reasons.
I am going to talk about organizing. The definition of the concept of organizing is organizing assists us in achieving the objective set forth by the planner. The synchronization and the combining of human, physical, and financial resources will ensure that the company achieves the desired results. These three resources are critical to the organization's ability to function and achieve the established goals. What is the importance of organizing? Organizing can help us to improve efficiency by efficiently managing time and simplifying procedures. Second, to create a better decision-making process. Decision-making is likewise improved as organized data facilitates insightful analysis and problem-solving. Third, to enhance productivity. Fourth, can help us to improve better time management. Next, I am going to talk about how the Ministry of Health (MOH) organize strategies. In order to stop the virus's spread, the MOH team needs to organize. First, setting up special COVID-19 hospitals, testing facilities, and quarantine areas. Second, public health measures like mask laws, social distancing, and cleanliness guidelines are implemented. Third, giving priority to immunization efforts. MOH identifies and isolates possible cases through extensive testing and contact tracing. Fourth, investment in research and development enables the adoption of strategies based on evolving data and scientific understanding. This comprehensive approach enables MOH to effectively organize its response and safeguard public health in Malaysia.
Okay, now I will talk about decision making. Definition of decision making is the collective process of selecting a course of action from multiple alternatives involving steps such as identifying the need for a decision, gathering relevant information, generating potential options, evaluating these options based on the pros and cons, choosing the most appropriate alternative, implementing the decision, and review the outcome to learn and refine future decisions. This process is essential in both personal and professional content as it directly impacts the effectiveness of action and strategy, and it influenced by factors such as individual bias, organizational culture, risk tolerance, and available resources. Importance of decision making. First, to achieve goal, resource management, problem solving, risk management, leadership and guidance, competitive advantage. Decision making is foundational element that drive effective action and strategy. Next, I will talk about how does the Ministry of Health decision making strategy. The Ministry of Health in Malaysia employ several key decision making strategies to effectively manage public health risks like COVID-19 pandemic. First, monitor trend in infection rate, hospitalization, and other relevant metrics. Second, conduct thorough risk assessment to identify potential risks and vulnerabilities. Third, collaborate with various stakeholders, including other government agencies, healthcare providers, academia, and private sector partners. The last one is develop policy and guidelines based on research, best practice, and international recommendations. By Employing this comprehensive decision-making strategy, the Minister of Health in Malaysia aim to effectively manage public health emergency, protect the population and mitigate the impact of infectious disease like COVID-19.
The last part in managing the issue is controlling. Concept of controlling. Controlling in management refers to the process of monitoring, evaluating and regulating organizational activities to ensure that they align with the established goal and objective. Monitoring how well the organization is achieving goals and take action to maintain, improve and correct performance. The importance of controlling is that it can discover irregularities to reduce costs, increase productivity or add value, to adapt to change and uncertain, and to detect opportunity. How Ministry of Health managing issue with control the pandemic COVID-19 in Malaysia? First point is Ministry of Health and Government in Malaysia take action quickly when the pandemic started spread easily and fast with closing the border. With this action, it can prevent disease transmission with the enforcement of health screening at a point of entry. This was done to detect among tourists and local returning from abroad if they have symptoms like fever and so on. This measure also involved airline crew, army and staff of KPM. Next, Ministry of Health and Tenaga Nasional Berhad established the coalition to obtain financial aid for support patients that be deceased with COVID-19, medical support and supplies. Other than that, the Ministry of Health set up the place for quarantine citizens and treatment centre for low-risk patients in the Agro-Exploitation Park Sedang, MAPS, in coordination with the National Disaster Management Agency. Finally, when they closed the border, they also quickly decided to do MCO to control pandemic from infected others. Ministry of Health also instructed to citizens in Malaysia and tourists of foreigner workers to follow the SOP that they had to do. For those who disobey, they can be sued or fined.
In conclusion, the COVID-19 pandemic was managed in Malaysia by the Ministry of Health through proactive measures, strong leadership, and engagement with the community. Definitely challenging were on board. However, such sensible approaches mitigate to a large extent the negative impact of the virus on the public health of the country, at the same time allowing the economy to reopen gradually. It is a continuous process where always vigilant and well-prepared effort can see the country through the pandemic and beyond. Apart from that, individuals and societies have become much more aware of personal hygiene and health practice. This COVID-19 outbreak has served as a good reason to the people to be more aware of current affairs, whereby they will be updated on the most recent information and recommendation given by health authorities.